Our topic for today is week 5, nursing care of the older adult in chronic illness. Our learning objectives is to explain the importance of sensory function and the impact of sensory deficits on older adults. Interpret the physiologic, psychologic, and environmental causes of acute confusional state and identify the sign and nursing intervention for older adults with cataracts, glaucoma, macular degeneration, diabetes retinopathy, and hearing impairment, and differentiate dementia and acute confusional state. Sensory impairment. Good sensory function is extremely valuable asset that is often taken for granted. For instance, people are better to protect themselves from harm when they can see, hear, smell, touch, and communicate. The reduced ability to protect oneself from hazards because of sensory deficits can result in serious falls from unseen obstacles and misalarms and warnings. Ingestions also of hazardous substances from not recognizing the bad taste and inability to detect the odor of smoke or gas and the burns and skin breakdown because of decreased cutaneous sensation of excessive temperature and pressure. Visual impairment. One of the most significant areas of changes that occur with age is that affecting the vision. The reduced elasticity and stiffening of the muscle fibers of the lens of the eye that begins in the fourth decade of life interferes with the ability to adequately focus, and this is the factor responsible for most older people requiring some form of corrective lenses, and this condition is known presbyopia. Visual acuity progressively declines, and this is due to reduce the pupil size, opacification of the lens and vitreous, and the loss of photoreceptor cells in the retina. What will be the personal cost for older persons with visual impairment? Number one, of course, there will be a loss of independence. Social isolations also, depression that can lead into depression to the older adult, and of course, decreased quality of life. Alam naman natin, di ba, if there's something wrong with our vision, we cannot do some things dahil hindi na natin sila ganong nare-recognize or nakikita. It's difficult for us to do our work. What will be the signs of difficulty with vision? Squinting or tilting head to see, just like sa mga matatanda, makikita natin, di ba? One of the manifestations, they put their hand to their head, and then minsan pagka tinatawag natin sila, medyo tinitignan muna tayong mabuti before na makilala tayo. What else? There is also changes in ability to drive, especially kapag kaya nagmamaneho and read, holding objects closer to the face kahit po nahahawakan nila yan. So matagal pa rin po nila ma-identify yan, titignan po nila ganong maigi. Difficulty with color discrimination, usually sa mga matatanda, the vision yellows with age. Older eyes are less able to distinguish the difference between the blues and greens. Avoid using color palette that is predominantly blue, green, or another cool color. Kailangan medyo striking color. Kapag ka meron kayong mga matatanda, yung hallway, lalagyan natin yung color na medyo ma-identify nila. Kasi yung mga color na medyo madidilim, medyo nahihirapan silang ma-identify yon. Hesitation in reaching for objects and not being able to find something. Kaya nga, di ba, kapag kasama natin si lolo at si lola, May bag yan. Yung bag niyan, hinalungkat ng lahat, may hinahanap, hindi makita. So that is one of the signs that there is already problem regarding the vision. Cataract, this is one of the problem encountered by the older adult. This is the opacity of crystalline lens or its capsule, partial or complete. This is common in older people because everyone develops some degree of lens opacity with age. So medyo yung ating mata, kapag due to the age-related changes, nagkakaroon ng cloudy. Okay, what will be the causes of cataract? It can be injury or traumatic. Pwedeng just because natusok, okay, so nagkaroon ng trauma sa mata, pwedeng maging cause po yun ng cataract. Exposure also to heat and ultraviolet light. This is also hereditary and congenital. So aging more than 55 or senile, sila ang madalas na nakaka-develop ng cataract. For those patients with diabetes mellitus, this is secondary. Smoking also and alcoholism, okay? One factor that may cause cataract. What are the risk factors? Okay? Because of increased age, smoking and alcohol, kagaya ng sinabi natin kanina, with diabetes or because of hyperlipidemia, trauma to the eye or injury, exposure, or using corticosteroid medication. Pwedeng maging factor din po ito that can lead into cataract. What will be the symptoms? Okay? Blurred vision from sunlight and bright lights due to cloudy lens causing the light to scatter. Glare also, there is glare, halos around the objects, double vision, lack of color contrast of faded colors, and poor night vision. These are some of the signs and symptoms. Actually, sa mga matatanda, makikita natin kung may cataract yan. Makikita mo yung meron siyang crystallize, yung opacity, makikita mo yung parang nag-white. Okay? Yung gitna ng mata ng isang may cataract. Makikita mo kagad na that is cataract. So what will be our management for this? Phacoemulsification. This is a tiny probe that is inserted which emits the ultrasound waves that soften and break up the lens so that it can be removed by suction. So, ito pong sinasabi natin, sinasuction po yung cloudy. Okay? Meron pong ini-insert inside the retina and then yung cloudy part po na lens, yun po yung sinasuction through emulsification. We also have what you call the extracapsular or intracapsular cataract surgery. Pag sinabi natin extracapsular, this extraction is a simple surgical procedure which the lens is removed and the posterior capsule is left in place. Pag sinabi natin extracapsular. Pag sinabi naman natin intracapsular, meaning inside, this is also a surgical procedure of choice for the older patients with cataracts and consists of removing the lens and the capsule. So this time, the lens and the capsule, pagka intracapsular, yun ang parehong tinatanggal. Pagka extracapsular, okay, remove only the lens and the posterior capsule is left in place. Okay, so what are we going to do? So ilang oras ba ang surgery ng cataract? Actually, it takes 3 to 4 hours or depende sa surgeon. Pero this is the outpatient. Okay, so hindi nag-i-stay ng matagal yung pasyente kapag cataract extractions lang, hindi siya nagtatagal inside the hospital. Okay, so after, what will be our nursing management? So after po na matanggal yung cloudy, crystalline opacifications ng mata, so medyo nilalagyan po ng patch yung yung kung isang mata lang muna, and then the patient is advised to wear yung pong actually for eye protections lang siya. That is yung plastic na isinusuot sa mata. Okay, that is for the eye protections. So what will be the prevention? Of course, avoid strenuous activities for a while. Hindi pwedeng magbuhat yung ating mga older adult after the cataract extraction. So iniiwasan natin yung mga trauma. Okay? So increase pressure, ocular pressure, yun ang iniiwasan after the surgery. Next, we have glaucoma. Okay? So glaucoma, this is increase in intraocular pressure, optic nerve damage, vision loss. Glaucoma is the degenerative eye disease which the optic nerve is damaged from above normal intraocular pressure. It comes after cataracts as a major eye problem in older person and second leading cause of blindness. Ang glaucoma naman, ito yung biglaang pagkabulag. Kasi pagka may cataract, compare with cataract, ang cataract makikita mo kagad yung opacity. Okay? Yung cloudiness ng mata, makikita mo kagad may cataract. Pero ang glaucoma, ito kapag hindi kagad natin na-manage, biglaan ang pagkawala ng paningin. So we have the open angle or chronic glaucoma. Okay? This is a peripheral vision because slowly but increasingly impaired. Some people may not realize for a long time why they bump or knock over the items at their side. So ito yung one of the symptoms na palaging nadadapa or nabubunggo. Need to change eyeglasses frequently. Kala lang natin, di ba? Kala lang ng older adult, simple lang na because hindi na appropriate yung mga reading glasses, pero hindi natin alam that can lead into glaucoma. This is the impairment progressive. Central vision is affected. They may complain of tired feeling in their eyes, headaches also, misty vision, or seeing halos around the lights. Symptoms more in the morning. And this is a slow flow of aqueous humor through trabecular meshwork build up to increase the the increase in intraocular pressure, damage to renal nerve fiber, or loss of vision. We also have what you call angle closure. Okay? So angle closure is the iris obstruct drainage of aqueous humor through trabecular meshwork. Increase intraocular pressure, visual changes. Ano bang procedure that can help? Okay? Detect increase intraocular pressure in the eyes that can help decrease. Ano ba yung dapat na gawin? To decrease the intraocular pressure. Okay? Trabeculectomy is the procedure. Tandaan ha, trabeculectomy is the procedure that can help to decrease the intraocular pressure in the eyes. This is used when the eye drops or other procedures are not working. So what are the signs and symptoms of glaucoma? There is unilateral headache. This is a headache on the left side which result from migraine, vasculitis, cluster headaches, or other types. There is also visual blurring, nausea and vomiting, and photophobia. What are the risk factors for glaucoma? Of course, increase intraocular pressure. Okay. So, paano natin ma-measure if there's an increase intraocular pressure? By using the tonometer. Okay? Tonometer, this is to measure the increase intraocular pressure. What else? Risk factors is older than 60 years of age, a family history of glaucoma, a personal history of myopia or with older adult with diabetes or hypertension or migraines. Also, this is most common in African American ancestry. What will be our nursing care? So, continue use of medication as order. Kailangan, after detections of glaucoma, you have to continue the use of eye medication as order. This is a combination of miotic and carbonic inhibitor or a surgery. This is to establish a channel to filter aqueous fluid. Okay, example, iridectomy. What else? We have to observe increased intraocular pressure. Avoid exertion, just like stooping or straining for bowel movement, cupping, heavy lifting, or wearing constricting clothing. Why? Kasi sabi nga natin, di ba, kailangan hindi tumaas ang intraocular pressure ng pasyente. So instruct the client also to report severe eye or brow pain or if there's nausea to the physician. And of course, eye examination. Another is age-related macular degeneration. Okay? This is the most common cause of blindness also in the people over the age of 65. It involves damage or breakdown of the macula, which result in the loss of the central vision. There are two types of the macular degeneration. We have the dry or atrophic form. This is involutional macular degeneration. There is a breakdown or thinning of the macular tissue. There is also atrophy, retinal pigment degeneration, drasin accumulation. So these are the yellow deposits under the retina that's made up of lipids and protein. And there is a slow progression of visual loss. Another type is the wet or neurovascular exudates. This is exudative macular degeneration. Okay? There is a retina scar formation plus the visual problems. There is also blurred vision, central scotomas or blind spot, and there is also metamorphopsia. This is a syndrome in which the shape of the object appears distorted. So what are the risk factors for age-related macular degeneration? Age, that is above the age of 50, of course, cigarette smoking, family history, increased exposure also to ultraviolet light, most common in the Caucasian race and light-colored eyes. Hypertension is another factor or cardiovascular disease and lack of dietary intake of antioxidant and zinc. Okay, so what will be our nursing diagnosis for vision impaired older patient? So first, we have to evaluate the functional ability. So ano ang kailangan nating makita? Okay. So you have to look regarding perform activities of daily living, including the ability to read medication labels. What else? We have to evaluate regarding drive or take public transportations. Ambulate safely in familiar and strange environment. What else? We have to evaluate regarding shop and pay for food and personal items. Also prepare food while maintaining a safe and hygienic environment. And of course, engage in recreational and leisure activities. We have to evaluate that. For sensory perceptual alterations or visual, so this is encompasses a variety of nursing goal and interventions communications. So number one is the safety. Kailangan alam natin yung safety ng mga older adult. And of course, mobility, self-care activities. We have to look for that. And mood assessment. Next is hearing loss. This is resulting from a variety of factors in addition to aging, like exposure to noise from loud music or jets or traffic or heavy machinery and guns. This can cause injury and loss. Hearing impairment should not be assumed to be a normal consequence of aging and ignore. Okay. So more than 30% of aged 65 to 76 years old is affected with hearing loss. 50% more than 75 years. This is most common in older women. Most affected is the Caucasian men and women, or this is more on African American men and women. There is also a temporary threshold shift. So, what are we going to do? Okay? Sounds. Pagka ang sounds while checking is less than 75 decibels, meaning there is temporary hearing loss. Kapag naman ang sounds, after checking, examination, more than 85 or 8 hours per day, plus many years, this can lead into what you call permanent hearing loss. We have the conductive hearing loss. It sounds unable to be transmitted because of poor reception plus amplification. So, most common, this is the site of problem. Causes because of otitis externa or because of infected cerumen or earwax. So what will be our treatment for this? Hearing aids that amplify the sounds, since the inner ear and the organs of the sounds perception are not damaged. We also have the sensory neural hearing loss. This is the problems with cochlea plus the auditory nerve sound distortion. So what will be the causes of this? Presbycusis. This is bilateral progressive hearing loss, especially at high frequency in elderly. High frequency hearing loss for excessive noise because of industrial noise or gunfire or rock and roll deafness. So, what are we going to do for our assessment? Of course, you have to get regarding the history. May previous ear infection ba? Or otitis media? Nagkaroon ba ng otitis externa? Nagkaroon ba ng infection? Ear infections. Okay, what else? You have to know and inspect regarding cerumen. Okay, so kailangan din po yun. So, kung merong mga previous injury, so you have to get all the history and ask the older adult. What else? For physical examinations. So, inspections pa rin, you have to look the ear, examination of ear canal. So, if there is a childhood ear infections, ruptured eardrum, jug, white scars on tympanic membrane in elderly. So, also, it is very important to undergo audio, okay, audiometer, okay, examination para makita if there is something wrong with the hearing. So check and use the audiometric. This is examination of the ear canal. That is very important. Siyempre naman, hindi ka naman kaagad-agad na kapag ka ikaw hindi ka nakakarinig, bibili ka na ba kaagad ng hearing aid? Hindi kaagad. Of course, kailangan ng examination ng audiometric. Okay? So, kailangan makita pa rin if there is something wrong, kung gaano yung mga decibels, kung nakakarinig pa ba or hindi na. Importante yon. So, Common hearing problems in older persons, tinnitus. This is described as the ringing in the ears. Parang may tining. Tinnitus is usually caused by underlying condition such as age-related hearing loss, an ear injury, or problem with the circulatory system. For many people, tinnitus improves with treatment of the underlying cause or with other treatments that reduce or mask the noise, making tinnitus less the effect. So what will be our nursing diagnosis associated with hearing impairment? So of course, assessment pa rin. Okay. And diagnosis. So protocol is cerumen removal. So some other older adult, because sabi nga natin, di ba, earwax. So due to age-related changes, medyo dumadami po ang productions niya. So this may cause, okay, hearing problems. Kaya nga minsan yung mga matatanda nag-undergo ng yung cerumen removal. Next is the taste. Okay, this is contributing factors to taste alteration. So ano mga problema, bakit nagkakaroon ng age-related changes, especially in the older adult? Oral conditions, okay, oral status that can affect gustatory function. Kung merong poor dentation, syempre sabi natin, di ba, pag matatanda na, medyo nagkakasira-sira na, nabubungi na yung mga older adult natin. Of course, you have to look. So, pagka may poor dentation, magkakaroon ng improper chewing. Improper pitting dentures that can lead into oral infections. Kaya nga kapag may denture yung mga older adult natin, dapat yearly pinapacheck natin yan. Kasi minsan, yearly, lumuluwag na yung mga dentures na yan. So what else? So another contributing factors is the olfactory functions or because of medication. Okay, taking of medications po pwede rin magkaroon tayo ng problema regarding the taste. Or if there is illness or diseases, or if you undergo surgical interventions, di ba? Actually, kapag may sakit ka, wala kang panlasa, nawawala yung panlasa mo. And of course, environmental exposure. So, xerostomia, this causes, okay, this is what you call dry mouth pag xerostomia. Dry mouth can happen to anyone occasionally. For example, when you are nervous or under stress. Okay, this is a dry mouth persists. It can make chewing, swallowing, and even talking difficult kapag medyo lumala ang xerostomia or dry mouth. What will be the causes of xerostomia? Systemic disease, it can be autoimmune disease, or because of radiations or taking medications, or because of Sjogren's syndrome. This is a condition that affect the parts of the body that produce fluid like tears. So what will be our implications for this kapag nagkaroon ng problema? Okay, regarding sa taste ng mga older adult. Siyempre, the implications, there will be altered taste, difficulty swallowing, that can lead into risk for aspiration, pneumonia, periodontal disease, speech difficulties. This can lead into embarrassment. Okay, what else? Dry lips and dry mucosa, it will increase the infection and dental caries. And of course, one implications kapag ka nagkakaroon ng dry mouth, halitosis and sleeping problems. So what will be our nursing diagnosis associated with taste impairment? So sensory, perceptual alteration, gustatory, okay? Intake less than necessary for caloric requirements. Of course, magkakaroon na tayo ng problema. Dry mouth, syempre, mahihirapang lumunok yung ating mga older adult. Okay? So, kapag ganun ang nangyari, syempre, hindi na sila gaganahang kumain pa. So, next is olfactory dysfunctions. So, statistic, this is more on female. So special concern. So what will be our special concern for this? Safety related to smoke and fire. Lalo na kung mahina ang pang-amoy, nilolot-lola at nagluluto yan. What else? Malnourishment. So sense of smell fails to be detected because it is not adequately tested. So kapag may problema, okay, hindi nakakaamoy, may problema sa ilong, there is a connections regarding the taste of the person. Diba? Kapag ka masarap yung pagkain na aamoy mo, syempre nag increase yung appetite mo. So kapag ka wala kang ganang kumain, kahit na masarap yung pagkain, hindi mo naaamoy, so syempre it also affect. Okay? Uh, yung taste ng pasyente, lalo na kung wala nang pang-amoy. So what are we going to do? So education, implications of inability to distinguish between salt and sugar. So ito yung sa mga matatanda. Kaya nga minsan, di ba, because nawawala na kanila yung pang-amoy, so ang implications nito, yung more on, mas, lalo na sa panlasa, no, mas nagiging maalat yung pagkain pagka yung older adult ang nagluluto. So decreased taste, lack of motivation to prepare, plus eat, that can lead into malnutrition. What will be the causes for olfactory? Okay, so kung hindi mo nakakaamoy yan. Nasal and sinus disease, or if there's an upper respiratory infections or head trauma. Okay, so sense of smell fails to be detected because it's not adequately tested. So what are we going to do? We have to use 3 familiar smell. So ang gagawin natin, just to test, repeat with both nostril in different orders, sensory perceptual alteration, olfactory. Doon natin malalaman if there's something wrong. Okay? Pag pinaamoy natin, oklud mo yung isang nose kung nakakaamoy. Okay? And then the other nose naman. Oklud mo yung isa. So malalaman mo kung sino ang may problema. So nursing diagnosis. So assess safety and preventive measures associated with hyposmia, sensory. Okay. Additional assessment for this, nutrition, you have to assess nutrition. Patient safety pa rin. Kasi sabi nga natin, di ba, pag hindi nakakaamoy, may problema ang pang-amoy niya. Baka mamaya, nagluluto, hindi na nakalimutan, patayin. So yung gas range na yan, pwedeng mag-cause ng burn yan. So what else? For patient safety, date and label all the foods. Place natural gas detectors in the home. This is for gas heat. And place smoke detectors in strategic locations. Establish a schedule for personal hygiene and house cleaning also. And remove kitchen waste every evening. Kasi syempre, pag walang pang-amoy yung mga matatanda, baka makain pa nila yung mga panis na pagkain. Pwedeng malason yung ating mga older adult. To recognize nursing interventions that can be implemented to assist the aging patient with sensory changes. So, nursing diagnosis for changes in physical sensation. Okay, so our next is regarding eye examination. Okay. So, syempre, di ba, paano malalaman if there's a problem bukod doon sa mga sinasabi kong sign and symptoms sa mga older adult? So, eye examination is very important. Healthy older adults, okay, especially for those patients with diabetes, kailangan palagi yan mag-undergo ng eye examination because one of the complications is glaucoma. So, assessment of vision, you have to observe regarding the appearance. Baka naman mamaya, di ba, meron cataract na pala yan. So what are we going to do? Observe. So tingnan mo yung clothing cleanliness. Kasi kapag may problema, yung mga older adult, baka naman mamaya hindi niya nakikita na marumi na yung damit niya. sinusuot pa rin niya. Of course, assess yung self-care. Okay, kaya niya pa ba? Naayos niya ba yung sarili niya? You have to observe. That is one of the assessment ng vision. And indication of bumps and bruises. Pag palagi makikita mo, may mga bruises, okay? Yung mga older adult. Meaning, palaging nababanggayan. Okay? So, kung palaging nababanggayan, pwedeng malabo talaga yung mata niya. So, in their interview, you have to interview regarding assess safety and preventive measures. So, adequacy of vision is very important. Or if there's a recent changes in vision, okay, pananakit din ng ulo, you have to observe. So, visual problems also. So, vision using the Snellen chart or reading from print, that is very important. So, syempre, di ba, kailangan para makita natin talaga kung ano ba yung appropriate reading glass sa ating mga older adult. Visual field testing also and extraocular movements. So visual aids, helpful aids for visual impaired. Lalo na kailangan malalaki po yung print niyan para mas nakikita at nababasa ng mga older adult. So visual difficulties may limit independence. So it interferes with ability to drive, lalo na kung yan nagda-drive, mga older adult, and also trouble reading and writing kapag may problema. So identification of safety problems at home, so provide. So what are we going to do? Kapag nakita na natin, assess natin malabo ang mata ng older adult, we have to provide adequate lighting in high traffic areas, recommend motion sensors to turn on lights when older person walks into a room, look for areas where lighting is inconsistent. So use proper lampshades to prevent glare. And use contrast when painting to the walls, floors, and other structural elements of the environment. Can be discriminated easily. So, kailangan yung mga color niyan, mga bright color. Huwag tayo maglalagay ng mga madidilim na kulay para mas makikita ng ating mga older adults. And of course, avoid reflective floors. So pag meron tayong kasama older adults, naku, huwag naman masyadong floor waxan at pakinisin yung sahig ninyo. Okay? So, pwedeng magkaroon din ng problema ang ating older adult. So, identification of safety problems at home. Use hot colors. So, ano nga yung gagawin natin? We use yung mga colors such as red, orange, and yellow for signage. And urge the use of supplementary lamps near the work and reading areas. Okay. So, for identification of safety problems at home, we have the extracranial disease. So, cardiovascular abnormalities. So, decreased cardiac output, state myocardial infarction or arrhythmias, or congestive heart failure, or cardiogenic shock. Okay, this is the extracranial disease na it can affect, okay, sensory perceptions of the older adult. What else? Alterations in peripheral vascular resistance, increase and decrease the states. Vascular occlusion or disseminated intravascular coagulopathy or emboli. Okay. For physiologic, psychologic, and environmental causes of acute confusional states in hospitalized older adults. So for physiologic, primary cerebral disease. Okay? This is a non-structural factors. Pwedeng vascular, there is vascular insufficiency or transient ischemic attack or cerebrovascular accident, thrombosis. Meron din tayong central nervous system infection if there's acute and chronic meningitis or neurosyphilis or brain abscess. That is under the non-structural factors. How about for structural factors? Yung mga structural factors, these are trauma or subdural hematoma or contusion, or intracranial hemorrhage. So, pwedeng kapag structural medyo nauntog, nagkaroon ng hematoma, or concussion, or contusion. Tumors also, structural factors po yan, primary and metastatic, normal pressure hydrocephalus. Those are structural factors. How about for, for inadequate, for pulmonary abnormalities, there is inadequate gas exchange, states pulmonary disease, or alveolar hypoventilation. And there is an infection that can lead into pneumonia. For systemic infective processes, acute and acute and chronic pulmonary systemic infective, pwede tayong acute viral, it can be viral or bacterial, just like endocarditis or pyelonephritis or cystitis or mycosis. We also have the metabolic disturbances. These are electrolytes abnormalities. Kung merong hypercalcemia, hyponatremia, hypernatremia or hypokalemia, and hyperkalemia, or hypochloremia and hyperchloremia. So drug intoxications naman, therapeutic and substance abuse, this is misuse of prescribed medications or side effects of therapeutic medications. O pwede po yun. Pwede rin magkaroon ng drug intoxication. Drug-drug interactions or improper use of over-the-counter medications. Or pwede ring ingestions of heavy metals and industrial poisons. Pwede magkaroon ng drug intoxication. For endocrine disturbances, alam naman natin, di ba, for older adult, so yung producing hormone cannot be produced anymore. So once na tumanda ka na. And of course, nutritional deficiency and physiologic stress pain or surgery. So alteration in temperature also, regulation, pwede magkaroon ng hypothermia and hyperthermia. So, another unknown physiologic abnormality, we have the psychology. These are severe emotional stress, post-operative states, lalo na pag bagong opera niya, or relocation or hospitalization. Okay? Depressions also, and anxiety. Pain, acute and chronic, pwede po yun. Fatigue, or under psychology, kung gripping, namatay yung loved ones, significant others. So sensory perceptual deficit also, okay, because of noise or alteration in functions of senses, pwede magkaroon ng psychologic problem. Or situational disturbances. For environmental naman, this is unfamiliar environment, creating a lack of meaning in the environment. So sensory deprivation or environmental monotony, creating a lack of meaning in the environment, or sensory overload. Okay? Immobilization, therapeutic, physical, pharmacologic, or sleep deprivation, or lack of temporospatial reference points. Okay, these are differentiating dementia and acute confusional state. Pag sinabi natin kasi acute confusional state, these are the clinical syndrome characterized by disturbed consciousness, cognitive functions or perception. Pag sinabi naman natin kasing dementia, this cause damage to or loss of nerve cell and their connections into the brain. So the symptoms affecting memory pag dementia, thinking, and of course, the social abilities. So the onset, there is acute, subacute, depends on cause, often occurs at twilight. So the causes is because of medication or drug toxicity under the acute confusion. Okay? So kaya nga minsan, di ba, it is important to know the level of consciousness of the patient. Conscious ba yung pasyente or hindi? So merong mga factor po yan. For dementia, this is chronic, generally insidious, depend on the cause. What will be the course? Okay, for acute confusional state, this is short. Okay, fluctuation, symptoms, worsen at night, dark and on awakening. So kaya nga minsan, di ba, pagising ng isang tao, no, may problema siya regarding confused siya, di ba? So hindi niya alam, tatanungin kagad natin, alam niyo po ba kung nasaan kayo? Minsan there are some factors kung bakit nagkakaroon ng confusional state. So, symptoms progressive for dementia, yet relatively stable over time. So the duration for acute confusional state, hours to less than 1 month. But for dementia, months to years. Okay, kasi pag sinabi natin dementia, this is degenerative disease eh. So awareness fluctuates, minsan alam niya kung nasan siya, minsan nawawala siya sa sarili niya. Generally reduced, but for dementia, generally clear. Alertness fluctuates also. So generally normal for dementia. Attention impaired. Okay? Generally normal for dementia. For orientation, fluctuates also severely, may be impaired. So the memory, recent and immediate memory impaired, unable to register new information. Pero for dementia, recent and remote memory impaired, loss of present memory in the first sign, and some loss of common knowledge. For thinking, for acute confusional, okay, disorganized, distorted, fragmented. And for dementia, difficulty with abstractions and word finding. So perception, distorted for acute confusional state, illusion, delusion, and for dementia, misperception. So sleep-wake cycle, disturbed, cycle reverse, and for dementia, this is fragmented. So for impaired verbal communications, what are we going to do? Okay, language barriers. Okay, kung bakit hindi tayo, di ba, palagi natin sinasabi, you have to establish rapport to the older adult para masabi sa inyo kung ano yung kanilang nararamdaman. So, language barriers siguro, kapag yung ating pasyente, Chinese, hindi naman tayo Chinese, pwede magkaroon ng language barrier. Mas maganda sana no? Kung mas naiintindihan natin kung ano yung sinasabi ng ating mga pasyente. Cognitive skills, these are developmental and physiological effects on the central nervous system. Short, long-term memory loss or functional. So sensory perceptual changes, loss, just like hearing, visions, and post-CBA or neurological disease. So receptive aphasia, client close, not have ability to receive or interpret verbal or non-verbal messages. So how do you communicate effectively with the elderly with impaired verbal communication? What are we going to do? Ano ba dapat natin gawin kung impaired ang verbal communications para mas maintindihan natin kung ano yung nararamdaman nila? Of course, first, you have to establish rapport, use proper form of address. Okay, so sabihin natin, oh, Mr. Joe or Mrs. Joe, proper addressing. Importante po yun, lalo na kung nasa ibang bansa kayo. Establish respect right away by using the formal language. Make older patients comfortable. Take a few moments. This is to establish rapport. So, ayan lang natin na magsalita yung mga older adult natin. Hintayin natin. Huwag kagad yung hindi pa siya natatapos magsalita, nagsasalita na kagad tayo. So try not to rush. Okay? Avoid interrupting, lalo na kung meron siyang ine-explain. And use active listening skills. That is very important, especially for older adults. Demonstrate empathy kung kinakailangan and avoid medical jargon. Okay? Jargon. Okay? Kasi baka mamaya ginagamitan mo sila ng mga medical term na hindi naman nila alam. So kailangan bumaba tayo sa level of understanding with all our patient para mas makipag-cooperate sila and mas maging maganda yung ating pag-aalaga sa kanila. Okay? That will be the end of my discussion lecture. So I do hope na you're going to study coverage for the prelim, week 1 topic. So the theories, okay, kasama din po yon. The role of the nurses. So kailangan din po yon. Importante din po yon. Week 2, okay, all the topics you have to read, especially the modules, and you para mas maintindihan po. Also, week 3, week 4, and week 5. This will be the last topic, pero it is also included to our prelim exam. So, good luck everybody. God bless. Salamat.